I want to just welcome everybody to the Maryland Lead Poisoning Prevention Commission meeting. I am Ruth Ann Norton. I will come on camera for just a minute here just to say good morning and welcome. We have a lot to cover today. There's a lot to discuss from the incidents around lead inspections. We're going to go over the strategic planning meeting that we had, and thank everybody for taking that day. As we do it, one thing before we get to our introductions, I do want to just make sure that we do thank the Maryland Department of the Environment for its incredibly good job that it continues to do, and on behalf of children, and sometimes with less resources than we want to make available, and our other state agencies that are deeply committed. I do want to let folks know that in the last 2 weeks, or last week actually, I had the opportunity to meet with the head of the CDC Lead Program, Paul Allwood, and his staff to go over sort of their renewed objectives now that the CDC Lead Program has been brought back from the death knell that it was dealt earlier. And a group of committed, mostly long-term federal employees trying to navigate their way through in support of states and in support of work. And we do have to remember there are federal employees trying to learn themselves about the shifting sands of things. But I want to thank all of the advocates, all of the members of the American Academy of Pediatrics, all of the folks that are on this call who helped to make sure that program got reopened. So it is reopened. Lots of very difficult things going on at the Center for Disease Control and Prevention, the shooting, the vaccine issues, that this team does deserve our partnership and support to try and advance what they can. Also had the opportunity to spend 2 days with the Environmental Protection Agency. Rick, I gave him all of your good wishes. It was on behalf of the EPA Children's Health Protection Advisory Council. And Grace Rubio, who heads the Office of Children's Health Protection, is again one of those amazing, long-serving federal employees that is navigating their way through. The good news for this group is that the entire almost 2 days was dominated by the EPA's public statements of commitment to lead poisoning prevention, and that lead is going to remain one of their highest priorities. They have what looks like a relatively good coordinator on lead, and I will ask her to attend next month's meeting. They are looking to do site visits around lead, and as tricky as that could be for people, they are asking to do that. I will tell you that I thought on the whole, there were some very good presentations by relatively new staff trying to give relatively good presentations and much more transparency on the chemical side, for example, than I expected. But the net of it was they are committed to lead poisoning prevention. There was some soft kind of encouragement that RRP will remain in place. When I did ask them whether or not they intended to roll back any of the provisions on dust standards, lead and copper rule, or other standards that have been so important to the success in this nation of lead programs, I received an answer of they could not answer that question now. It was not, yes, we're going backwards, but some of the higher ranking members of the team there, the deputy administrator and others, did emphasize that they're going to be cutting regulation, that they do care about cost to businesses and to the public. So I do think we have to be vigilant in how that will impact us. Even though Administrator Zeldin said in his opening remarks and throughout, there was a strong emphasis on lead as the thing that seemed to be the primary goal for them among children. So let me, Wendy, let's get to, I'm happy to answer questions on that, but that's what I know at this point. We will certainly, if the commission wants, we'll ask Grace to come to a commission meeting and try to navigate what she can and where we are, and the CDC Lead Program. If this commission wants to do that, we can extend those invitations to have conversations. But
somebody has their hand raised. Michael Ignaski has his hand raised.
Yes, Michael, and thank you again to the AAP for the advocacy. The AAP has been enormous.
Thanks, Ruth. Just had a question. Was the full staffing restored to the lead program at CDC?
I think it's about, my impression was it's about 50%. They've had a lot of retirements. They had a lot of people who took the exit. There were people pending the exit. I know our experience working on the EPA Thriving Communities program is 90% of the staff that we've been working with are gone. CDC is having a very high attrition rate. I will say it did seem like there's commitment for some people to hang on there and try to thread the needle on the administration's commitment to lead as a bipartisan issue and see what they can do. Cliff may have more information because MDH, kind of wanted to go backwards there. I'm not sure, Cliff, if you've had conversations with CDC or Fred has had conversations with CDC or others, but certainly that's open question.
Yeah, I think that, Ruth Ann, you're exactly right. There's been a huge wave of people who took the fork, the early retirement, early in the process in April. And so, although a lot of the RIFT employees who didn't take the fork have come back, overall, I think CDC is probably, especially at the National Center for Environmental Health, and it's, I think, true at National Center for Environmental Health and the National Center for Injury Prevention and Control, they were, I think, even more severely affected than some of the other centers.
Yep. And Fred, I don't know if you guys have had much conversation. They did kind of assure me that MDE would continue to get its dollars. One hopes that is that will happen. But I do see now that we've got a group that has joined us in the conference room. I want to thank people. I want to apologize for just being so under the weather here today that I'm not able to join you. Wendy, if we could do introductions and then get on to the agenda, and we'll turn that over for Cliff's active leadership. Cliff Mitchell has agreed to be the facilitator for most of the meeting. I'll stay on in background. I also want to acknowledge that we are very fortunate to have some community members today that will be speaking at the end of the agenda from Baltimore Renters United. I want to thank Nadia Hutchinson for bringing that voice. I want to thank Laura Bartok for her work in helping us facilitate the summer meeting. And I don't want to delay further. So let's get into it. Cliff, thank you for your partnership. I'll play color commentary today and let you run the agenda.
Thank you, Chair Norton. And Wendy, why don't we just go ahead and do the roll call?
Yep, we can do that. All right, I'm gonna start with Adam Skolnick.
Yeah, Adam Skolnick, Executive Director of the Maryland Multi-Housing Association, Commission Member.
Ali Nestat.
Hi. Oh, Ali Nestat, Parent Advocate, Commission Member.
In the room. Thank you, Allie.
In the room, yes. Sorry we were late. We were downstairs.
Hey, and Fred, or Paula, if we could move the camera slightly so we could see the people on the left, not just the people on the right. I don't know if you, there you go. Oh, thank you.
Yes,
Sorry,
Fred conveniently took himself out of the picture, which I noticed was deliberate on his part.
Yeah, I gotcha. Okay.
And we have Anna Davis won't be here today, but I think I do see Barbara Moore.
Hi, I'm Barbara Moore. I'm pediatric nurse practitioner and director of the lead poisoning program at Mount Washington Pediatric Hospital. Commission member.
Benita Cooper.
Good morning. I'm Benita Cooper, Executive Director of Property and Casualty Complaints, Maryland Insurance Administration.
Cliff Mitchell.
Present, Maryland Department of Health.
Fred Banks.
Right here.
You're present. Okay. Mangela Paul.
Good morning, Mangela Paul from Maryland State Department of Education from Office of Child Care. Thank you.
Michael Ikoniowski.
Hi, everyone. Mike Ikniowski from the Maryland chapter of the American Academy of Pediatrics Environmental Health Committee.
Nadia Hutchinson.
Nadia Hutchinson, member of Baltimore Renters United. Thanks for having me.
Nicola Tran.
I'm Nicola Tran, a director of the Whole Home Energy and Repair Programs at DHCD.
And then Ruth Ann, which we saw in the introduction. I think I think there's a caller online. Is this Susan Kleinhammer?
That is me. Thank you very much, Wendy. Susan Kleinhammer, accredited risk assessor, Lead Tech Services. Good morning.
Good morning. So Fred, can you go around the room in the conference room and announce, if you can go around for those who have not yet introduced themselves, present in the conference room, that would be great. So I can take attendance.
Okay, we'll start with.
Hello, I'm Joelle Conway, one of the board members.
Hi, good morning. My name is Mark Moore. I'm an attorney in Baltimore, and I handle a lot of matters pertaining to lead-based paint.
Hi, I'm Rashad Taylor with the MDE, with the registration and surveillance, new employee here. Nice to meet everybody.
Well, welcome, Rashad.
I'm Paula Montgomery. I'm with Maryland Department of the Environment. Good morning, everyone.
Okay, thank you very much.
Cliff, I lied about one thing. I have one more thing at the top. So I forgot to mention, and when I saw Nicola, it reminded me. I just want to say there is a group of advocates, healthcare providers, and government folks trying to coalesce a coordinated response to the continued impacts of the Western Maryland floods. Included in that is some extraordinary exacerbated lead-based paint. I just want to let folks know that if you're interested in assisting, helping, the 22nd through the 26th of September is going to be an emphasized coordinated community push to get people resources around these issues. I want to thank Nicola for joining the call this morning and getting and all of the state on that, but we are looking to reach all of the families. A young man, age of 16, died from asthma as an impact of those floods. But in the houses, there's severe lead issues as well. And so we're trying to compel that work, and we'll be able to talk more about that in the next meeting, but I meant to raise that. Now we'll get it to minutes and club. Sorry about that.
Nope, no worries, Ruth Ann, and the Allegheny County Health Department has been very much part of that discussion as well. So thank you. All right, so if we can turn to the agenda, can we please have committee members, council, commission members look at the April 2025 minutes, and assuming that everybody has carefully and studiously perused the minutes, Do I hear a motion to adopt the April 2025 minutes?
So moved.
That was Adam Skolnick. Do I hear a second?
Second.
And who was that?
Fred Banks.
I don't know, Mr. Banks, but we'll let him go ahead and do that second. Is there any discussion? All right, call the motion. All those in favor, please say aye.
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 Opposed? Abstentions? All right, the minutes are approved. And if we can now turn our attention to the May 1st, 2025 minutes. Can I hear a motion on the May minutes?
So moved.
Thank you, Adam Skolnick. Is there a second?
Second. Fred Banks.
The invisible Mr. Banks. Thank you. Yeah, no longer invisible. Is there any discussion on the motion? If not, all those in favor of adopting the May minutes, please indicate by saying aye.
Aye.
Opposed? Abstentions? Minutes are adopted. All right. Okay, so now if we can return to the agenda, we'll start with old business. And the first item is the overview of the strategic planning effort that was launched and culminated in the Strategic Planning Day on June 24th, 2025. And I think what I'm going to do is take the acting chair's prerogative, do a brief overview, and then spend the bulk of the time talking about the issues presented, if that's acceptable to everybody. And I will certainly entertain additions, comments, emendations, and corrections from the folks who were present at the meeting. The meeting convened on June 24th, and first I do want to acknowledge and thank Maryland Department of the Environment for hosting and allowing the event to take place on its facility, and to GHHI for support of the meeting as well. So the morning session was really intended as a background / context setting session, and it included presentations from MDE and the Department of Health related to the current status of childhood lead poisoning overall, including both enforcement, abatement, and then on the human health side, surveillance and intervention. So I think all of you should have, all of the commission members should have a copy of the notes from the day, and I really want to thank the note takers, and in particular Laura Morlock, for the really excellent job of capturing what was a very rich conversation around where we are as a state, and a little bit in the context of where the state is in relationship to the national effort and commitment to end lead poisoning. I think the highlights of the opening session I will leave to others, but the question that was raised one of the questions that had to do is figuring out how much of the work that is going on in lead abatement is institutionalized, how much of it should be and is and needs to be advocacy versus recommendations and best practices versus regulatory relief or regulation. And there was also a very, very spirited discussion around issues of equity and reach, particularly with respect to some of the non-center of Maryland urban areas and how to address some of the challenges of lead and lead paint contamination in areas that are not as full of government and or hospitals and medical staff as in Metro Baltimore, Metro DC. The second part of that discussion had to do with where we were with childhood lead poisoning. And Fred Banks did a really superb job of presenting materials. I'm assuming that all of those materials will be in fact made available to the commission if they've not already been distributed. Is that correct?
Yes, that's correct.
All right, so I think the slides will be made available to commission members. And Wendy, I don't know if they've already gone out. I don't think I've seen them, but I'm Ruth Ann or Laura, are you the keepers of the presentation materials, or does that live with Wendy?
We haven't received those from MDE, but Fred and I can work to get those out along with this. I think so many things were happening over the summer.
Sure.
Changes.
Yep.
I think the goal here is, and I'll ask Laura if she wants to have any other highlights, or Wes here, but I think what we, in the course of the day, what should, how are we going to address this issue and support the department under state budget pressures, right? To have the capacity and resources to prevent what has occurred with the highlighted by the Barkley case. How we will strengthen the commitment to criminal as well as civil actions on that. I know Chris and others are on the line for that. But what are we doing about enhanced and deepening education resources throughout the state, equipping people? We have a really effective notice of defect if it gets into people's hands, but the resources to take that, utilize that in court. I know we have, I think, Mark, I forget your last name that you introduced yourself, but we have a number of resources through legal aid, through tenant advocacy, through GHHI, Baltimore and Maryland Renters United in trying to do that, but we need to coalesce those actions on the ground. So I think it really around deepening the education and advocacy work, deep concerns that budget cuts and funding not being in state budgets around that has got to be changed. But that's the key takeaways. But I don't know, Laura, if you're on the phone, if you wanted to add anything, or others who were at the meeting. But I do think the next step is for the coalition members to come back. We need to vote on priorities for this commission. We are an advisory body, not an actual implementation. Our goal is to give the best advice to the state on what we need to do to stay ahead of this issue. We also did have a discussion, right, on other sources that are being seen. And Barbara, I know you weren't able to maybe comment before me, but beyond the paint issues, the other impacts of other sources, but having the resources to ensure that the Housing Choice Voucher Program stays in place, potentially gets expanded across the state, not just in Baltimore, and to make sure that we have advocacy for kids in rural and urban communities. Cliff, I would invite comments from others who were at the meeting. But I think the issue that has been hanging most is how do we appropriately advise the state on this inspection issue and tools for families immediately. I do also have to say, and I hate to raise this, but the city has a lot of lead money that needs to get out or is at risk of going back. If it goes back to HUD, it will put the state in a terrible position. The state has fortunately gotten some grants there for other parts, but we have to be making sure that we're getting resources out to families and getting those implemented and used. And we need to give a lot of support to Nicole Hart and others on that to make sure that's happening. I have the amazing respect for Nicole and what they are trying to accomplish, but it takes all of us getting those resources out and utilized. And I know we'll hear from both inspectors and community members today, which is great to have at this. So I'm so glad that people are showing up to this, and it shouldn't just be in a crisis moment, but let's utilize this as a moment to see what we can move forward from the meeting. But I would just encourage others who are there to speak up.
Thank you, Chair Norton. Other comments, there is, and again, if you look at the notes that were really, really superbly done, you'll see a lot of the themes that Chair Norton just described in bold, particularly in the second part of the notes on the afternoon session, when there was a lot of effort to identify cross-cutting questions. So with that, let me just open it up for commission members to comment, including but not limited to commission members who were there at the time. So comments from the commission.
What about Laura? Nadia, Fred, anybody who was there?
So Ms. Johnson.
There's Laura.
Yeah.
Go ahead, Laura.
Yeah, thank you so much. It was a pleasure to join the group for the strategic planning day. And I think for me as the facilitator, my main takeaway is that there really are no easy choices or decisions to be made left. Maryland has been so successful in reducing lead poisoning. And I appreciate the framing that I believe it was Fred Banks who shared at the end of the meeting when we were reflecting collectively on takeaways. That Maryland was the first through the door, was sort of a first responder in many ways to addressing lead poisoning concerns. And now we're at the point where it's as Ruth Ann pointed out, time to prioritize, make recommendations, but having to think really carefully around what has been working well, where improvements can be made. And again, I think a main focus of the conversation that I took away was not just having policies in place and programs in place, but ensuring that the state is communicating effectively, strategically, and carefully about those available resources and programs to maximize that investment. So yeah, I think overall, the day laid the groundwork for some helpful and important next conversations about how to carefully assess what opportunities and challenges still exist and make thoughtful recommendations to the state in these areas of tough choices, of which audiences or stakeholder groups might be important to target with some outreach or connect with. How might the commission structure need to change in order to more accurately reflect stakeholders and residents throughout the state, and thinking about some of those really tough challenges when it comes to the methodology of testing, but also reporting back on that data. So yeah, it was a great conversation, I think very productive, and set the stage, I think, for those conversations around how to expand beyond the margins and continue to build on the successes that Maryland has had.
Thanks, Laura. And what I'd like to do, Wes, if it's okay, I'd like to hear from the commission members first, if you don't mind.
Sure.
But I think, Cliff, in that, just to add on that, one of the things that I took away was this need to create a fund that for all of the, what I will call squishy, what is currently squishy but needs to be defined stuff, right? We know there are pockets of money for lead hazard control. we've got to get those dollars into the hands of people, right? And ensure that landlords are using those dollars as well as homeowners, because we still have a very high risk and a big problem in the rental community, and we've got to get that. I know Adam's got his hand up, but there also, I think the state needs to, this group and others need to work together on creation of a private fund that can augment state money and fill in the gaps that we allow us to better engage the public. I know you have Michael and Adam there. So
Yes, I believe Michael had his hand up first. So Dr. Ikniowski.
Thanks, Cliff. I just wanted to say I was glad to meet everyone in person at the meeting, my first in-person meeting with most of those folks on the staff here. So that was a good opportunity. I'm glad I was able to take advantage of. We did have discussions around trying to improve testing in the state of Maryland. I don't know that we came up with any definite solutions because, you know, money is where a lot of that would be needed to implement more broad scale blood testing on kids. But just that we did have a good discussion about that. And like I said, we don't necessarily have the solutions without the money to provide solutions, but that is an ongoing task for the commission to work on.
Thank you, Michael. Adam?
A couple of things. One, I'm still going through it, so I haven't really had the opportunity to read it in full. Two, I mean, I think that having done a lot of strategic planning at varying organizations, I think there's also a level of, you know, pick the time frames. I'm a fan of kind of 1 to 18 months and then 18 to 36 months. And what are those 3 to 5 goals that the commission has from a 30,000 foot level that we can work towards? So like, you know, this is a great working document that started, but there's, you know, as well we should have done, we've thrown kind of everything on a wall that's in this document. Now we need to kind of, you know, slice that down to what are the top 3 to 5 things we're trying to get accomplished in the first 18 months, and then what are our longer term goals as a commission. If those goals are recommendations to the state for legislative things or the department for things, whatever they are, at least it's goals that as a commission we're working towards to try and make a difference. We all understand that we're in an advisory role and we can't actually do anything specific, and we all know that, and that's kind of what our role is. So I think, you know, whether that's everybody goes through on votes on their top 3 things or however Laura suggests that we go through that. But I mean, I think that, you know, that's the best way, in my opinion, to proceed. But you know, I'm open to all kinds of other ideas. So.
And Adam, I think that's right, 3 to 5. I will also say that while we are advisory, our voice in raising these issues, convening a public forum to raise these issues. So the MDE, MDH, DHCD, and others hear directly on what needs to get done, what we see needs to get done. The price of success is sometimes silence, and we need to be really making sure that we are ruffling all of the feathers to make sure we're hearing from as many people as possible who aren't getting buried in what is a public health and very important, successful set of work. There's a lot we will hear today. There's a lot left here to be done.
No, I agree. I mean, I think that we should set a deadline for ourselves of, and I'm making it up, next month's meeting to have decided, these are the things, and then the priority number 1 for the next meeting should be, let's hash out if we're all in agreement on the top 3 to 5 things for that time frame. And again, if the time frame is shortened or lengthened, that's up to the group. I mean, whatever everybody thinks is reasonable. So
I think what we can do is do a survey or put a set of questions out from those who attended this meeting. And obviously we'll hear from others today around that, and then organize that in hearing from folks, and then organize a formal vote on the 3 to 5 priorities next meeting. I would suggest, Cliff.
Yeah. So if you want to make that motion, I'm open to having a motion on that. If somebody feels as though they are capable of articulating a motion, it sounded to me as though the motion was that a group that was originally present at the commission, at the meeting, plus additional volunteers, get together and draft a series of concrete proposals in the form of a list with timeframes and present that for discussion and a vote potentially at the next meeting. Is that what I heard?
I think it's to synthesize out the recommend from the meeting, the potential proposals for commission priorities, which we can send out either in a survey type form that people, or a way that people can be thinking about how they want to formulate that into a vote in October. So I will commit, I'll commit, and certainly that we will do that and work with, if there's others from the meeting who want to, we'll synthesize that, we'll circulate that to make sure it makes sense, and then we will formulate that into an agenda to vote on at the next meeting, and give either we can determine if we're going to do ranked choice voting, which might be the best way to do this. It's a controversial for elections, but might work here, or straight priority voting.
Yeah, Cliff did not. I don't think I mean, getting Robert's rules wonky, I don't think we need a motion because we all agreed to do a strategic planning session and we already voted on that. So this is the outcome of the strategic planning. So I don't know specifically if you need a motion to vote on the fact that we need outcomes from the session.
No,
I mean,
but
these are
I
the
do think, Adam, I think that we should probably have a formal commission articulation of what that process is going to look like, because it's going to be a vote and a series of recommendations. I just want to make sure that the commission is clearly on record legally as having decided what that process is.
Gotcha. Yeah, I'm good. I got you.
Yeah, that's why. And two things about that. One is I want to make sure that there would be a cross section of people, not just any one group or organization, but there's a cross section of members of the commission who participate in that drafting process. And then the other thing, I think, for context, just for everybody to think about a little bit in terms of timing, to Adam's point, is there are two sort of, I think, at least two big events which are likely going to have an outsized impact on what we decide to do and how we decide to do it. One of which is Congress's adoption of a budget for the next year, which will, particularly with respect to Medicaid, have significant implications for the population health here in the state, and potentially for many of the activities that we are going to be interested in. And the other is obviously the State General Assembly will be looking at the governor's budget in the January timeframe. And so just thinking about that, those are the two events that I would point to as things that we may want to consider in terms of when we get the clock going and how far we go in terms of thinking about the timing of recommendations.
Cliff,
So-
do you have, I know you're sitting, we're trading chairs back and forth, but if you have a way of articulating this into a motion, I'll take back the chair for 30 seconds so you can do that.
Sure. So I think the motion, I think that what I heard was that a group of commissioners will meet, including people who were present at the and part of the strategic plan, but not limited to that group, to take the planning group's notes and create a series of recommendations with timeframes, and that would be done within the next 2 weeks and sent out to the commission as a whole for consideration and vote and a formal vote at the next commission meeting.
Do I have a second?
Second.
Great. Any discussion? All in favor of Dr. Mitchell's motion?
Aye.
Hi.
Any opposed? Wendy, good luck getting that into the minutes in a concise form, but I think we know the charge here. Let me ask that if you are interested in being on the drafting committee, we'll get the meeting date scheduled quickly, but let Wendy know by close of business tomorrow.
Wendy, I'm volunteering now. It's Adam.
That's Adam Skolnick, correct?
Oh, Adam, if you hadn't volunteered, I would have volunteered you.
I knew, Cliff. That's why I spoke up immediately.
I'll volunteer on that. And Cliff, I'll hand you back the baton now. And I think you had others that were non-commissioned hoping to weigh in.
I certainly, this is Susan. I would certainly volunteer for that also.
Fabulous. All right. Thank you very much, everybody. We will certainly continue, I assume, Chair Norton, to take additional volunteers after the meeting.
Through close of business tomorrow, people should email Wendy. Wendy, by close of business tomorrow, please forward those names so we can coordinate that. And I encourage as many people to do that as possible.
Okay.
Agreed. Thank you very, very much. And thank you, everybody, for the robust discussion. Wendy, I'm just going to note that the September 4th meeting agenda that went out officially is not exactly the same as the meeting agenda that you've got.
Yes, I'm actually added and amended as we were talking, so.
Okay. Thanks. All right.
Yeah,
So
it's a live amending here, so. Yeah, Ruth Ann had mentioned in our last discussion, she, and I don't know, Ruth Ann, if you want to bring that up now, about changing possibly or potentially changing the commission meeting schedule. So I thought that was important to nail that down if we are going to do that, so we're clear on when we're going to be meeting.
There's been a lot of push by commissioners directly to say that monthly meetings, we don't have enough. I think right now for the fall, we do have enough. And I would suggest that any potential change in meetings should start in 26, either to go every other month or to go to quarterly. But we can, I would suggest that we put maybe this table this discussion until after we get the strategic plan goals done. Chair Stewart's got his hand up again. And thank you, Wes, for your participation. But I'm going to suggest, if it's okay with everybody, that we put this discussion off and have it so MDE can plan it properly for next calendar year if we see fit at that point to do that.
Wes, do you want to go ahead and say something?
Right. Just one of the key aspects also coming out of the planning day was looking at reestablishing working committees for the group. So in looking at the overall effectiveness of the commission, part of the discussion was also looking at which quarterly meetings would allow that, but to have interim meetings of working groups on specific topics, likely informed by the priorities of the commission. But just in terms of that mix of that would be part of that consideration for the commission as well, is what are those committees and then when would they meet? The idea there was to be able to drill down more research, more discussion, more looking at best practices and coming back to the commission as a whole with recommendations from those committees and report outs. So
for things like inspection and testing, enforcement, right? Funding, that sort of thing. And I do think we can incorporate that in this 2-week period that we're going to do that. It could be a recommendation to reestablish or establish those committees. I'm not sure they've ever been fully established over the course of the commission. I had a long gap in my participation, but attending those meetings, don't think they've ever been functional. But I think the point here is a good point raised by Mr. Stewart, which is if there's a lot of work to be done on enforcement, it would give us a tight committee to be looking at that and report progress. So we'll take that up in this, both in the next 2 weeks and then as we think about the schedule.
Thank you very much. Our next agenda item is Lead Poisoning Prevention Awareness Week, which this year is October 19th through 25. And I just want to start by saying this is historically an effort that has been led by the Department of the Environment, the Department of Health, and working with GHHI cooperatively. I do note this year, obviously, Lead Poisoning Prevention Awareness Week has some particular significance because both of the strategic planning efforts and what is the context of the national efforts or the national picture on lead and pretty much all of environmental health. So there is a group working from GHHI, MDE, and MDH that has started to meet. And I don't think we've clearly adopted a theme as yet, but Shadia Muse has been working from GHHI to herd the cats that are the agencies. Let me just say, being one of the cats, I take full responsibility for that. But
feisty but lovable, Cliff, as always. So thank you for that. I just want to briefly give some context. So like you said, Cliff, I mean, from a national perspective, I believe the EPA is leading like the national theme, agenda, outreach materials, etc. You know, in alignment with their commitment to lead poisoning prevention, hazard reduction. However, we are still waiting for that theme. I'm currently on their website, and they do say that those things will be available in early September. It's still early September, so we're going to kindly wait. However, we're going to keep on herding the cats and keep it pushing. So all that to say, we have confirmed something. So I want just everybody to stay in the loop as these things become finalized. Again, we will share with the entire commission. But we are going to be doing our press conference in Baltimore County this year. Last year was in Baltimore City. We were again celebrating the 30th anniversary of lead poisoning prevention across the state. So it was really imperative that it was in Baltimore City last year. This year it'll be in Baltimore County. And again, we're going to frame this issue it's a statewide issue. It is, like Cliff said, we are really focused in on Central Maryland, but again, this is a statewide issue. So really kind of branching out more into our rural communities. So with that being said, we were going to do a lunch and learn, partnering with Dorchester County Health Department in Cambridge, Maryland, preferably on Tuesday of that week. Moving forward, we are going to do a webinar for property managers and property owners on that Wednesday. And as well, we're going to be partnering with the Baltimore City Health Department on their efforts to do canvassing. And yes, Ruth Ann, we are going to do a tenant-based lead education session along with Baltimore City Health Department as they continue their efforts in Curtis Bray and Brooklyn Park. There's going to be a resource fair on that Wednesday. Again, educating families about lead poisoning prevention, our services here at GHHI and other services around the state. There is going to be a testing initiative as well from the Baltimore City Health Department. And we have a beautiful opportunity this year to partner with GHU HEAT, which is the, let me make sure I get this right, Health Education Training Corps. And we are going to be working with some students from Merit Health Leadership Academy to help us with our canvassing efforts during National Lead Poisoning Prevention Week. So we have a lot of things up in store. Again, just stay tuned as we get all of those invites together. So thank you for giving me the floor, Cliff. Appreciate it.
Shadia, can I just add that we are encouraging other groups to be doing things, and if they need resources, they need support, etc., we will help with that. We're reaching out to community organizations across the state to do that, and we can help to find resources, support in any way, we want to do that. And we will help publicize those events as well, to make sure that we're reaching all 23 counties, Baltimore City, in different ways, in different formats. So can I please, Shadia, tell people they should reach out to you at smusa@ghhi.org. Maybe you'll drop your email there. We want really a robust response, and I encourage our assessors, inspectors here to be teaching people what they should know in the communities. We will join with people. We will promote and produce webinars that people may want to do as well, on various issues of access, learning, etc. And we'll get Rick Kessler doing some sort of song video dancing during the week, right? I think, Rick. But we want to get out there in every form. And as we have further discussion here, as we hear from both public and members, please, we want to really get robust in our actions, not only this week, but moving forward.
And I see that Director Kessler has raised his hand.
Yeah, I just wanted to say this is all great, and just to add that discussions have already begun at MDE about an event to highlight this. We'll be talking with GHI and with the commission, trying to find something, and of course with our partner agencies, Dr. Mitchell, and others, to find the best way to bring the most attention to this issue. So
Rick,
stay tuned. Yeah.
Can I suggest it would be good to get all of your agency leads, the governor's office, to put out some messaging videos, but you have a Just Communities program throughout the state, that in that Just Communities program, from the money that is associated with that and the Enough programs, both site led. I don't know how many communities know what's going on with that. An effort by the state to engage that, or for DHCD, for example, where there are grant funds on home repair and other things that could also include lead. We really want the public to know what resources are out there and how to access them, right? So.
Thank you. Anyway, I just wanted to let you know that, yes, we've already begun thinking about this, and looking forward to working with you on it. So thanks.
Thank you, Rick. And just for people who may not know about the Just Communities, the legislature and the governor have established a criteria for communities that historically have suffered disproportionately, both in terms of environmental exposures and in terms of adverse health outcomes. And so some of those outcomes include lead poisoning, higher rates of asthma and myocardial infarction and heart attack, and as well as low birth weight outcomes. And those communities have been designated and identified by the Department of the Environment along with other agencies. And there is an effort to specifically address those historic disproportionate exposures and adverse health outcomes. Okay, thank you very much. And thank you, Wendy, for monitoring the agenda. I believe the next item is going to be commissioner reappointments. And so I will just say there is a process for commissioner reappointments. If you are interested in being reappointed, Wendy, I believe the process still is that you have to fill out the application on the governor's website.
Yeah, I'm going to send out, this is just as a reminder, basically they scatter the reappointments every year. So we have two commissioners that their term expires this year, and I will send an email out reminding, so Cliff and Alexandria Nestat. So both of you, your terms are expiring. So I'll send you an email with links to the governor's office. Basically, you follow the links, reapply, and they'll reappoint you if
Well,
and
assuming that they, in my case, decide to do that or
yes.
decide
And once
to
they
find
do,
somebody else.
yeah. So you'll get an email confirming your reappointment if they do that, and an email with an attached letter. So once you get that, you can forward to me so that I have a record on hand. But I just wanted to mention that to both of you. So it officially expires September 30th. So if you can start that process now, I'll get that email out to you shortly.
Thank you very much. All right, the next agenda item is funding restoration to the CDC. I think that everybody understands that at this point, as you all know, Congress has not yet adopted a budget, and so everyone is waiting to see what Congress decides to do. The agencies are obviously following this very closely, and I assume many others are following this closely as well. And I don't know if any commissioner has anything else to say on that subject, except keep watching. Michael?
I like most of us, I've seen varying reports as to whether the funding has been restored to the budget or not. I know the Medicaid funding is going to impact it too in terms of testing. If a lot of kids are thrown off of Medicaid, then the ability to receive medical care, have testing done is going to be impacted by that, above and beyond what might be cut or restored to the CDC. Do you know at present what the status of?
So the House committee just recently adopted a budget for HHS, and there were some significant programmatic cuts in the House budget. I will just say this is even more in flux than usual, partly because the president's proposed budget included not just budget cuts, but wholesale either elimination of programs or moving of programs to the agency whose acronym is MAHA, and I will say nothing more about that. But at this point, the Senate committee has also got a proposal. We do not at this point have any idea what a conference committee process would look like. We don't know when that is going to happen. And so the House version didn't accept in fact, didn't accept many of the proposed moves of programs wholesale to MAHA that were proposed by the president. So as far as I'm aware, at this point, we have to wait for the conference committee we have to wait for formal adoption by both the House and Senate, and then a conference committee. And that's going to be an interesting September.
Thanks, Cliff.
I got nothing more than that. If anybody else knows more than that in tea leaf reading, I'm happy to hear it. Ruth Ann, did you want to say something?
No, it doesn't say that there is good news on the HUD side of monies that have gone into home repair, the continuation of the HUD land hazard control and healthy housing budgets. But I think it is interesting territory for what is going to happen on the EPA CDC side. EPA did indicate that they thought there would be new monies coming out. May not be. I think the quote to me was in a conversation with one of the deputy or assistant deputy administrators was, it may not be how we want to see the funds come out. I don't know what that meant necessarily, but I assume that was a reference to environmental justice. But they will be coming out in some way, monies around the issue. I don't know if any of the former members of EPA here have any more insights on that. In talking with the CDC program, honestly, I want to be honest that I felt like they were recovering from some trauma, trying to get their feet straight and trying to understand what they would be allowed to do in this effort. And I say that with all due respect, but that is the impression of what I saw
I think
in the conversation.
I think that's exactly right.
So it's like Lead Week or our funding or all of these things, right? I think we're trying to say with the fair-minded people that may exist in those agencies, et cetera, around these issues, right? If they, those who do, or if they do, fine and great. If they show up to do on mission the right things, good. But it is really incumbent that states are picking this up, that we are leading for our communities and leading with communities. It may be the thing that we strengthen most in this challenging period is how do we lead with communities at the forefront. So we'll see. TBD. We'll be fighting like hell for the monies, but TBD.
Thank you, Chair Norton. All right. Fred, our next agenda item is, I believe, MDE. Green Environmental Bar.
Yeah, so just for context, we investigated a company, Green Environmental, for potentially falsifying lead certificates and associated documents. Once we identified the certificates that were invalid, first we reached out to the public, I believe in February of this year, just giving them a heads up that the company was under investigation and that we recommended they get their properties re-inspected. Once we confirmed, we sent out notification in June that those associated certificates were invalidated and property owners had 30 days to get their properties re-inspected and begin the registration process. We're in the process now of going through that list to determine who's been re-inspected, who has not. Sometime in the next week or so, we'll begin enforcement action on the property owners that have not complied. We fielded a little over 800 calls in the last 6 weeks regarding this incident. Couple of hundred emails, a mix of property owners, inspectors, and tenants. We'll do a follow-up report once we've kind of cleared the enforcement actions, but our hope is that we'll be able to work through the enforcement actions by the end of the year and get those all cleaned up. As you guys know, there's a lot of press around this case, and surprisingly, a lot of inspectors reached out to us with thank yous and congratulations and support for what we're doing. The company was essentially negatively affecting not only public health, but the business as a whole, just by undercharging and under delivering. So that's kind of where we are. We'll keep you posted. Any questions, comments, concerns about anything?
Yes.
Yep.
Again, my name is Mark Moore. I'm not sure this is the appropriate time or not, Commissioner Banks, but I have several questions about the invalidation of the lead certificates. I think you just said notifications were sent out in June to all the property owners. Is that correct?
Yeah, we initially sent out a public notice in February.
Right.
Letting people know that this company was under investigation, suspected that those certificates would be invalidated. We sent them to the tenants as well.
Right.
And then we followed up once we confirmed that they weren't validated
So,
in June.
I'm sorry. So I have the department's pronouncement of July 31st, 2025. And it indicates that the department had invalidated more than 1,400 lead inspection certificates.
Correct.
Does that sound right? Okay.
Yeah.
Do you have a firm number at this point, or is it still just?
So if I can just break in for a second, Mr. Moore.
Sure.
I guess I have a question just about what your goals are here, because I want to distinguish between the commission's work as a commission and any specific questions that you have related to the processes involved here. I'm wondering whether or not we shouldn't take those at another time other than the commission's time. And I want to be respectful of the commission's role here. So I'm not questioning your motive, but I do want to recognize that we have an opportunity for public comment at the end of the meeting, and you're certainly welcome as a member of the public to comment, but I don't want to have the whole commission necessarily, especially if this is going to be a series of prolonged questions for specific purposes. I'm wondering whether or not it wouldn't be better appropriate and more appropriately addressed in some other terms.
Well, I don't have too many questions, but I'm happy to do this in whatever manner the commission would like me to do it. I will say that what I really want is I want the department's position on certain aspects pertaining to the invalidation of these certificates and the efforts by the property owners and managers in terms of how to get into compliance.
Yeah, no, and I can understand that, and I see that Rick Kessler has his hand up. I'm just going to say, as a commission acting chair, that I think that kind of question would be better addressed directly to the department, not in the commission meeting, and I'm guessing that might also be Rick Kessler's.
Okay, that's perfectly fine. I appreciate that. I just want to know to whom at the department to address these questions.
Rick?
Yeah, thanks, Dr. Mitchell. I think I agree completely with Dr. Mitchell's statement, and I just wanted to offer to you as the director of Land and Materials Administration, which houses the lead program, we're happy to have that discussion outside this meeting. I think Dr. Banks, if you're good with it, you would be, I would say, as the program manager, you and leader, you're the most appropriate person. Happy to join, but we can settle that outside this meeting.
That's perfectly fine. I just, when can we do that? Can you give me an idea of that?
Who's the counsel handling this case?
Well, I think you spoke to maybe Matt.
I'm sorry. I'm sorry. Is there a case we're discussing here?
Yeah,
Specific?
yes.
I mean,
So I'm just, I think as the commission chair, I'm just going to say anything legal, we should not be discussing.
I agree. That's
here.
exactly where I was going.
Okay.
So
I'm
going to just, if I may, I'm just going to arbitrarily say that this entire discussion is now going to be tabled. Mr. Moore, I can direct you to the Department of the Environment for any subsequent conversation, but I don't feel that it's appropriate for the commission.
Okay, well, just to be clear, I'm not discussing any particular case at all.
No, and I understand that, but I think why don't we just table this discussion and conversation? I would direct you, as Director Kessler said, to the department in an appropriate,
Yeah. Why don't you email me at rick, R-I-C-K, .kessler, K-E-S-S-L-E-R @maryland.gov. And
can I just weigh in here to say there is public comment at the end to talk about policy recommendations, the public input. I want to encourage everyone who has something to add into that. I do think the distinction here is where this may cross into legal cases. The commissioners, we have no purview over that, but we have to respect the department's role in that. So, Mark, I apologize for not remembering your last name. I know it starts with an M.
Moore.
It's Moore, M-O-O-R-E.
Okay, I can remember that. Thank you, Mark. And appreciate what you may want to be accomplishing here, but we have certain rules and guidance we have to follow. But Cliff, I think the intent of this on the agenda was to have the state give an update to the commission and the public on the actions to date.
Yep.
Have the commissioners ask any questions around that. The balance should appropriately move to either public comment or direct meeting. And that is not to stifle people's voices at all. We're trying to just follow what we can do. But if there are commission member questions on that, and then as we move to public comment, I know that, for example, I saw Mr. Connor had put a bunch of things also in the chat, which we'll share both if people can see or in the minutes. And then I say we move the balance of this to what we can do and accomplish in public discussion.
Hey, Mark, it's Adam. It's been a long time. Call me anytime if you have other questions. If Fred doesn't answer them, and I'll help you as well. No problem.
Okay, thank you, Adam.
Yep.
All right. So let me just then turn back to Dr. Banks and Fred. Is there any other update on this, or are you ready for questions from the commissioners?
Ready for questions.
Okay. Any questions from the commission on the Green Environmental Bar plate?
So, Fred, I had to step out of the room. I apologize if I missed this. I'm interested to ask what the status is or is not on criminal prosecution of this case, not only the civil, but is there criminal prosecution being brought by the state? Did you say on that? If you don't mind, if you're repeating yourself, I apologize.
Yeah, there is criminal prosecution being has begun. I'm not sure where they are now, but Mr. Barkley has been made aware of and been served by the ECU unit, Environmental Crimes Unit, and as of now, I don't know where that case stands.
Could I ask that MDE facilitate letting the commission and the public know if there are hearing dates for that, if they have been scheduled in the courts, or at least maybe finding some way for that public information to get out further, because the public may want to weigh in that process with the Attorney General's office to know. And so do that. I want to yield to Commissioner Hutchinson. I see. Yeah.
Yeah, thank you so much for this update on the case. I was wondering, for the homes that have not been remediated, what is going to be the next steps or actions for the impacted renters in these situations?
So there's a couple things that so essentially, if the properties haven't been re-inspected and if there was defective paint, has not been repaired, there's a steps or processes that the landlord, one may be relocating the families until the work is done. The other may be repairing the defective paint if there is any. So it's sort of reviewing each case by case, getting our inspectors out to follow up with the property owners to make sure the property's in compliance, and then looking to see what the schedule is for any repairs that may be needed. So
the tenants were notified too,
yeah,
right?
tenants were notified.
Yeah. Evicted ones?
Nadia, did that answer your question?
Yes, it did. Were tenants notified more than that first time?
Yes, they were notified in February, and they were also notified. Whenever we send a communication to the property owners, the tenants will get it as well. Now, if the tenants weren't in that location where the property was defective, we wouldn't have a way to contact them, so.
Okay, thank you.
Any other questions for MDE on this case?
Cliff, this is Sue Kleinhammer.
Yes, go ahead, Sue.
I mean, I'm sorry, I can't raise my hand. I'm on.
Yeah,
phone,
no,
but,
go ahead.
You know, I do want, the one thing that I have seen in the field is that I think that I hope MDE keeps in mind that the other victims of what Rodney Barkley has done are the actual property owners. You know, I'm hearing it from the property owners themselves, you know, that, you know, they hired somebody off the accredited list, and that, you know, they themselves, you know, are victims, and that I would hope that MDE would have patience and understanding that right now at this point, while Rodney might have done it while the unit was vacant, now we may actually even trigger a worse situation because these units are occupied. And my experience has been, yeah, there is lead still in these units, many of the units that Rodney did. What we certainly don't want to have happen is that in an occupied unit, that a property owner trying to do what MDE is asking for in a timely fashion goes ahead and does mitigation in an occupied unit without using people who are lead accredited. And so I think we need to understand that one of the things that I, you know, would like to have in mind here is that one of the big goals of the commission is to also maintain low-cost affordable housing. They've now incurred additional costs while doing what they thought was right by hiring an accredited inspector. And now they have to pay for it again, and it could even be more expensive because the units are occupied. Thank you.
Thank you, Susan Kleinheimer, because that in part was where I was going.
Yeah.
Okay.
I'm sorry, was that Patrick or sorry?
No, that was Mark Moore. I was just
Okay,
thanking
no,
Susan Kleinheimer because in part that's where I was going with some of my questions.
Yeah, no, I thank you very much. Ruth Ann?
I understand and get it on the harm that is across the framework here, including harm to responsible inspectors, right? And now being treated skeptically. But there is law in place here. Units cannot be rented if they don't meet certain levels of standards and clearance and those sorts of things. And while it is harmful to those owners who got duped here, we still cannot be just saying give a pass and have units be put on the market that are not clearing the normal standards of protections for families. And that is a balancing act that we're all going to have to do. But we have to protect families and children, not to just go into a unit because somebody duped somebody and not have in place those prohibitions against renting without the proper clearance. I don't think anybody is necessarily saying that, but I just wanted to underscore there is law in place about the ability to put a unit on the market that MDE does, in my view, have to stand up to.
I see that Commissioner Skolnick has raised a hand, and I also see a hand from Patrice Dorridge.
Right.
And go ahead.
So I mean, Ruth Ann, I think that everybody in the property owner world agrees with you on if it's a vacant unit and it goes on the market, it's got to meet the requirements that MDE puts in place. I don't think anybody's arguing. To Susan's comment, the issue is the occupied units, and you've got this failed, potentially failed occupied units being retested, and how you handle and how the department handles that unit, that testing, the process, the timing, and the expectations of those property owners. But on the vacancy side, we're all in agreement. You got to abide by the law. This is that nuancy thing that the law was never going to really capture, that a licensed inspector, lies, cheats, and steals. And now you've got both the residents of those rental units and the property owners stuck in the middle. And we need to worry about both. Obviously, the kids in those units or pregnant women have got to be at the top of the list, but we've got to worry about all parties.
So if I may, I think that I'd like to take these last two comments and then move on because I understand that this is a case we're going to be following obviously for some time, and I think it is important for us to monitor. The commission, I don't think, has a specific proposal before it to discuss. So if everybody's in agreement, I would like to take two public comments on this at this time rather than at the end of the meeting.
I do want to just say, Cliff, if I may, Delegate Rosenberg is seeking to formulate some legislation in response to this. I want to make that transparently clear to people in the public that Delegate Rosenberg is looking to do that. I don't think there's a formulated piece of proposal from his office yet, but he is concerned about this. He's concerned about the impact it had in the Park Heights community and others. And I do anticipate that there will potentially be a piece of legislation to try to not only ameliorate, but to support and help impacted individuals in this. So I would just say there is interest in that legislatively. I don't know that Delegate Rosenberg has anything he's ready to talk about, but I do want to make sure people know that he is looking at this and working on that.
Talk about a case.
Okay. Ms. Dobridge, ordinarily we take public comments at the end, but I see that you've got a hand up.
Cliff, I'm going to jump in. I'm sorry, Ruth Ann. I just want to make clear, MDE is not going to, beyond a description of the status, discuss an ongoing case in this forum. I am not.
We understand
We're
that.
not
because
prepared. We
wanna-
don't have the
Yeah.
AGs with us. So I
Right.
just want to make clear, we cannot and will not answer any specific questions related to things that are subject of an ongoing case or cases. So not just the one that's on the agenda.
Can he define that?
So Ms. Dobridge?
Yes, hi. I'm Decrease Dowry from Executive Director of Baltimore Runners United. I just wanted to clarify something that Ruth Ann stated earlier about property managers or owners getting duped. From an organizer's perspective on what we're seeing on the ground, we do have landlords and property managers out here who knowingly hire people that they know aren't lead certified just so they can rent out the unit. So just wanted to really just make that clarification and to be careful to not lean so on the side of property managers or landlords getting duped and things when some of them are knowingly hiring people that they know aren't lead certified.
I think I was trying to say what you're saying. I wasn't the one saying that. While they may say they have been duped, they have certain obligations they must live up to. So I'm in agreement with what you're saying. Just for clarity, my point was I was trying to be very clear that tenants, families should not be put in this position and that we should not let down our guard on the obligations they have. So I appreciate, Ms. Dowridge, your comment. I think it was from your comment on that. That's what I was trying to articulate. So thank you.
Thank you both. I'm gonna make this the last comment if that's okay with everybody. Ms. Cobb-Williams.
I just wanted to remind the commission that this meeting is subject to the Open Meetings Act and it's being recorded. And so when discussing issues and using adjectives and certain terms when referring to individuals, people may want to be careful how they do that, because this is subject to the Open Meetings Act and it's available for the public.
Thank you, Ms. Cobb-Williams. A reminder that I was going to issue as well, so thank you for that. All right, I would like to move on to the next agenda item, which is, I think, the CHIP program Medicaid federal unused Medicaid dollars. It's not Medicaid's dollars. We are not medicating anybody. This is Medicaid. So, Wendy, could you just correct that agenda item to indicate that it is unused Medicaid dollars. Thank you. All right. And I don't know. I'm a little bit at a loss as to exactly what is intended by this item. It refers to DHCD. And Nicola, I don't know that there are any unused Medicaid dollars at this point.
I'm not sure exactly what this item is referring to.
Yeah, I don't know that we have at this point unused Medicaid dollars. The CHIP program, just for everybody's benefit, including any new commissioners, the CHIP program is one of two programs having to do with a state plan amendment. Maryland being one of very few states that is using currently administrative funds that are allocated to the states for program administration. They're allowed to use a percentage of those funds for preventive programs that are not directly service programs, medical service programs. And Maryland in 2017 got approval from CMS to use CHIP funds matched by state funds to abate lead homes containing lead paint for children on Medicaid who meet criteria of having elevated blood lead levels and residing in the properties at least 10 hours per week. Those funds are, there are state funds that are used for that, and then they are matched roughly 2-to-1 by federal dollars under the federal medical assistance percentage. I don't know exactly what is intended by that agenda item. We have seen historically the state has done some significant lead abatement some properties abated using those funds. In addition to funds that come directly to Baltimore City, the Department of Housing and Community Development, and Baltimore County, and now Cambridge from HUD.
So I think part of it was to see what the ongoing status would be with all of the different CDC efforts, et cetera. I think originally.
Okay. So what I
yeah.
So what I can say about that is that this program is not dependent on funding from the CDC or to the CDC. This is part of the Medicaid programs and CHIP program authorizations, which are separate from CDC operational funding on an annual basis. And they are more likely to be affected by any changes specifically to CHIP. It's not even Medicaid, it's specifically the authorizations for CHIP, which I think are reauthorized for several years, and I don't know exactly when they will that. So
I will say, I know we're not on this, and I don't want to put the city on the hot seat here, but I do want to ask if the city itself, on its lead funds, what assistance we can give to make to ensure that we're keeping those monies, that they're getting out and moving dollars. I'm getting deeply concerned about not having any city, state, county return funds, because one thing we've been able to do at the HUD budget is keep that moving forward because of use, demand and use. And I don't know if any of the HUD grantees, the city and others on here who are and only government can receive lead dollars, if there's any updates that anyone would like to give.
So I see Catherine Taylor and Brianna Adams are here from Baltimore City, from Department of Housing and Community Development, and from the Health Department. And I don't know, Catherine, do you Want to address the question?
Hey Cliff, yes. So unfortunately, I mean, no one wants to return HUD funding, but our grants, at least our older grant, the 2019, which we received $9.7 million. It took a really hard hit in implementation phase for the first 2 years, which the grant was awarded in 2019. We didn't start unit production until 2022. So having a late start on these grants definitely impacted our ability to kind of catch up to the benchmarks we were originally planning to reach. But I do think with us having a delay of completing 110 units from 2022 up until last month, I think that it's still a win. And HUD has been aware about our struggles and have been very understanding in a way, meaning we were even able to get awarded another grant, which, I mean, if this was a serious issue, I could perceive that they wouldn't have granted us another opportunity to kind of do this again, because they do understand the need in Baltimore City. So right now, I think with our new grant, we're at a pretty good footing. We are ready to start unit production, which is way ahead than what we projected. So I do have a better footing. We have better footing at this time. I think in regards to just commission assistance and support is just getting the word out there at every opportunity. We have as much brochures and flyers that we can provide when requested, or any presentations that you need us to do. And I would say that's all we really need right now, just getting the word out there.
Catherine, thank you for that. And
Look, Cliff, I want to just say, and Catherine, I respect all of that. I'm just going to say that HUD is being very clear publicly that they are looking at entities that are returning funds as a way to not give money. We are in Maryland, we're already a target to some degree. I want to work with the city on this, making sure whatever we can do to minimize that, and appreciate the point of view and the concern, I think, is real and valid, and to see what can happen to minimize any impact there. Definitely concern on the conversations in Washington about minimizing dollars to certain states, minimizing dollars to any states that return funds for any reason. That's the concern, that's the issue. And I want to just say, I think we all want to help in any way that you see fit to help with that. So appreciate your comments.
No problem.
Yeah, thanks.
And
Chair
feel free to
Norton,
reach out
and
if you guys have any other questions too.
thank you, Catherine, very much. Okay, so I think at this point, why don't we go ahead and go to MDE for any updates?
Yeah, we're preparing for we also been working with local health departments and MPH, local health departments, specifically Anne Arundel, Howard, and Baltimore City.
Excuse me, Fred.
Yes.
Can you put the microphone a little bit more towards you? Because I'm having a hard time. I don't know if anybody else is, but I'm having a hard time hearing you.
Thank you. Is that better?
Yeah, that's a little better.
Like I said last week, the local health departments and MDH did a training for our staff and for the community for just walking through the case management process for exposed children and families. I believe it was Anne Arundel County, Howard County, and Baltimore City did a great job. Outside of that, it's we're moving forward. We got some new staff, 2 new division chiefs, and a couple new inspectors. So we're trying to get them on board, and working with some of the other partners, MSDE, Ms. Paul, and some issues with them schools as well. So, yeah, that's it for us.
Thank you, Dr. Banks, and I apologize for the sound quality there for those of you who are online. In the room, just make sure, if you would, that the microphone is as close as possible to you, close as possible when you speak. Thank you. For MDH, I think we've covered most of the topics. We have been working, as Dr. Banks said, we've been working very closely with the Department of the Environment and local health departments on lead case management issues. We have been having conversations with some health departments about what exactly the next year is going to look like. A lot of uncertainty around that because of changes in Medicaid or potential changes in Medicaid funding and what that might mean for people. And we're also thinking about how we can do more granular analytics around populations at risk and where those risks are and where testing is taking place and not taking place, and working with the Department of Environment to think about how we strategically plan for the next phase of testing strategies. AAP, Michael, any updates?
Yeah, the state AAP chapter is having their annual meeting a week from Saturday. And I just wanted to ask you and Ruth Ann if you had anything specific you'd like me to bring up. I have a brief presentation time to talk about environmental health issues during the course of the meeting. So if there's anything specific, any resources or contacts that you'd like me to share with providers that are seeing kids in Maryland?
I will say that, Mike, if you can touch base with me separately outside of the meeting, we probably want to just chat briefly about radon as well as lead and asthma and other home-based clinical conditions, and just sort of think about what that presentation at AAP might do. I'd be interested.
Okay, thanks, Cliff.
Yep. Mangela, Office of Child Care.
We are busy helping the programs to ensuring the lead testing, and we are experiencing increasing number of children coming from other states and then translating our requirement for testing. So I'm providing them with the specific guidance based on what is happening with the child and other situations. So just wanting us to know that, yes, we are getting children from other states, and what whether we can have some kind of language or guidance for those children, when and how they can be tested.
And let me just add to that, I think one of the truly unfortunate side effects of national policy related to immigration is that we are seeing a large number of children whose parents are reluctant to bring them to any kind of attention, including medical attention or registration for lead testing, because of concerns that it will identify them. So I will simply observe I don't have a solution for that problem.
Agreed. And it's same for immunization too now.
It is clearly a problem, and an increasing problem. Ms. Johnson, I see your hand. Can I just ask, can we get through these, and then we're going to have time for public comment, and you can raise your question then? Is that okay?
The button was hit by mistake. My apologies.
No problem at all. I have more than once raised my hand when I had nothing to say, and sometimes I even just take myself out of the meeting altogether. You're in very good company. All right. Ms. Cooper, any insurance administration updates?
I don't see her on the meeting. She must have had to drop off.
Okay. All right. Nicola, any updates from DHCD?
Yeah, we're working on trying to get the program off the ground. We got the healthy lead hazard reduction grant, so working on getting those up and running. Our programs, however, are running, so we are continuously serving customers with those. One thing to mention is September 16th, will be the next meeting of the Green and Healthy Task Force. That is specifically looking at that whole home housing treatment plan for how all the needs in a household can be addressed through retrofits. And then the other thing to mention is that we're starting to plan for the next Empower program cycle. So that's for the Empower Energy Efficiency Program. The next plan will be due next year, and there's going to be a work group in case anybody is interested in the more of the efficiency side of things, but I know this is only slightly adjacent to what we're doing here.
Thanks, Nicola. That's very, very helpful. For Baltimore City, so first of all, Nicole or Catherine? Any other updates?
So we have started our new grant period. So we have been starting targeted outreach throughout the city. So you guys may see a lot of door hangers coming around, just trying to get our numbers back up with our new grant, which has been going pretty well. We have our contracts already set, so we're good to go. But like I said kind of earlier, of getting support of getting the word out there, we would love to be able to provide you guys with any information on our programs to put out to the public. Thank you.
Thank you very much. Brianna?
Good morning, everyone. Just want to reiterate some things that Dr. Mitchell and both Catherine said. We're focusing a lot on outreach. We are committed to doing at least 5 events or resource fairs within the city, just to provide more outreach on lead and to also try to build a lot more partnerships. When it comes to Lead Week, we have partnered with iHeartRadio. This was also mentioned because of the current political climate state. We've seen some of our numbers go down because some people are afraid to let us in their homes to do EIs and to bring their kids in for inspection. To bring their kids in for testing and other immunizations. So we are working with iHeartRadio for outreach and providing a number of information in Hispanic language. And also, again, tying that to Lead Week, we're going to be canvassing at the end of September in the Curtis Bay, Brooklyn area. That's where we're going to be contributing our efforts to during Lead Week, providing a number of door-to-door knockings, working with the parishioners in the churches, a lot of partners where the individuals in that community receive their resources. The plan for Lead Week is to hold one big resource fair that Wednesday, offering resources not only for lead in education, but asthma, tobacco, and other social disparities. And then for Thursday, holding one big testing day from 9 a.m. to 3 p.m. Also wanted to announce that Lead is looking for a sanitarian supervisor. After 26 years, Valerie Millings will be retiring. I think the last time I was on the meeting, I announced that we were looking for sanitarians. We have been able to hire 2, but now we're looking for a supervisor. It took us about 8 months to hire those 2 sanitarians, and we're hoping that it doesn't take us that long to replace Valerie.
Brianna, can you post a link to the position? I know we have some good inspection firms here, but we have a lot of different groups, or at least share the link so people can promote the need for that hiring.
We currently don't have a link right now, but I'm working with DHR to double post the position so we can have someone come in while Valerie is still working to help transition smoothly. So once we have that, I'll post that and I'll send it to the commission group.
Wonderful.
Brianna, I really appreciate that. Let me just say that Baltimore City has lost or is losing 2 people who really made the lead program what it is today. And do you just want to mention, Leona, both Valerie and Yolanda? Because I think
They're retiring. They're not.
Yeah, so Yolanda last day was last Friday. Yolanda retired.
Yeah.
And I've said this plenty of times. She was short of 37 years. So it was 36 years, 11 months, and about 16 days. So we have someone who's currently transitioning and getting her acclimated into Yolanda's role. But with that, losing one person, we're also looking for one more community health educator. But again, losing Valerie is, I'm hoping we don't take a hit because she's a very great sanitarian.
Yeah. No, and I just wanted to point out, Paula, is that there's a huge amount of experience in Baltimore City that this is an important transition time because there's a lot of history that goes with those two individuals. So, not just them, but certainly. All right. Baltimore Renters United, Nadia.
Yeah, I don't have any updates, but do know that there are some folks in person that wanted to provide public comment. So I will.
Yes, yes, Nadia, and we welcome them. Could the Cliff go ahead? But I knew
so
that. I don't know, Cliff, if I got that message over to you. Sorry.
Yeah. No, okay, no, that's totally fine. Because I'm. Is there any follow-up or update from GHHI that we haven't heard already?
I'm going to yield that because I know we have a lot of public comment. People who took the effort to come, and I think we will send out from GHHI's lots of effort, lots of information.
Perfect.
And I want to thank those who are coalescing around this education advocacy issue. Let's turn this over to any remaining commissioner comments and get to public comment because I know that is a critical part.
Okay. Any further commissioner comments or updates? Anybody? Going once? Going twice? All right. Public comments now. Can I ask, just for purposes of order, if you are interested and you are on a computer, can you put your name in the chat so we have the correct spelling of your name? And I will take public comments in the order that people put their names into the chat. I know that Patrick Connor, who's a former commission member, already has put a large number of comments in the chat, and we also have some folks from Baltimore Renters United. So why don't we go ahead? Fred, I saw you saw Heather Johnson. And if you can limit your comments to 2 minutes, please, so everybody has a chance to comment.
Oh, wow. Thanks, Dr. Mitchell. It's wild to be told that I have 2 minutes when so many people have had so long, but I understand. I'm going to go ahead and make sure that I comment on a couple of things that I heard that not only do I have confusion on, but I am concerned as a person who is working with the people that you want to, which are impacted folks. The first question is going to be centered around what, are you Dr. Fred or Commissioner Fred? I want to get your title right. Fred's fine. All right. So one of the things that Fred said, and this, just so that for notation purposes, this will not have anything to do with the case. My question was to Fred when we were on mute was, what about the families who already been evicted on these fraudulent, what do they call it, certificates? And then I understand a little more about the commissioner, but for you people that are asking to be recommissioned, have y'all ever been impacted by lead? And thank you for answering that for me. And what does that look like for the community that you want to be in. I've heard that a lot of people are getting ready and getting started for Lead Week. But we currently have people that are in their house right now that have to wait for 2 weeks to be spoken to about these next steps. And they've already been impacted. I appreciate that you reached out in February, but I know tenants who haven't been reached out to. And Maryland Department of Environment says that they fine folks, FINE, for money, $325 a day. And folks have been living in those houses for years, and there's no reparations that I've heard mentioned. And then I will leave my other questions to the people who left early. So I'll just email Rick.
Okay, thank you, Ms. Johnson. Sherelle Conway.
Can I just say that thank you, and if you could get those questions in writing, we try to get them out to lots of avenues there that you've indicated. Happy to follow up offline to do that, and sorry for the limited time, and if we maybe plan a future agenda a little bit further together to expand more time on that. But if you send the email questions over, we'll try to get connected on a lot of those different issues. Some of them do cross into private litigation, some of them cross into the state action, some of them cross into housing court. But appreciate the advocacy, and if you could do a follow-up in writing, and Nadia as well, this that I think would be helpful to try to get back specific answers.
Will it be able to be a public conversation? Because it sounds like a lot of things happen offline. And I would like to be able to invite people, especially commissioners that's been impacted by lead, to have their voice. I really rock with Sue, Mark Moore, and Nadia for having those questions, so that they could be able to put this fire to people's feet. People are homeless right now because of these fraudulent certificates. People literally have no reparation, and they have called the DEA, and all of these organizations work with each other. So you can't even get help from the Attorney General's office to go after the Department of Environment because they all getting paid by the same folks. So I'm gonna shut up. But I really appreciate you, Ruth Ann, Commissioner Ruth Ann. What organization do you represent?
I think there can be lots of venues for public meetings on this and people invited. If you get that in writing, and we'll start there, we will try to address that in all the ways that can get the best responses.
Thank you both very much. Ms. Conway?
Yes. Hi, I was listening to, hello, everybody. I was listening to your presentation, and I heard the part about, something about the lead certificates, et cetera. My one question is, because I know y'all don't want to have it on an individual case basis, what are y'all planning to do to assist these people that have been caught up in these situations where certificates have been purchased illegally and people are currently going through legal issues with their housing behind the fact that these certificates were allowed to be monetized in the first place?
Okay, thank you for that. I think, before we get back to that, are there any other folks who have public comments? I see your two names, and I don't think I see any other, don't see any other requests for public comments at this point.
Patrick Connor's on there.
Oh, Patrick?
Yes, Cliff. I'll stay less than 2 minutes. All I want to ask, and it is not case specific at all, but with Commissioners Kleinhammer and Commissioner Banks, when you start publishing information, if you can separate it between risk reductions, lead-free certificates, and lead-free limiteds. Because the corrective action for those three categories are completely separate.
Just so you know that.
And I just think that will assist the regulated community in contributing the proper responses for their very specific situations. And I'm not seeing that yet in the public domain. Thank you.
Thank you, Patrick. For those who don't know, Patrick served on this commission for many years, and so I just want to acknowledge his alumnus status on the commission and in the WED community, although I don't know that he would consider himself an alumnus as much as an active member.
I'm an interested party, but thank you.
Yes. Yeah. Okay. Well, it's 11:27, and I want to acknowledge that we will end the meeting on time. We do have several agenda items. Our next meeting is set for October 2nd. Within 2 weeks, we should be sending out the draft of the proposals for strategic planning. I want to thank everybody for both spirited and active discussion of some important issues related to lead poisoning and lead poisoning prevention. And obviously, there's a great deal of interest in many of these topics, which we will come back to, obviously, in future commission meetings. With that, I would be happy to entertain a motion to adjourn.
Motion to adjourn the meeting.
Any second?
Second.
Under Robert's rules, a motion to adjourn is not debatable. So all those in favor of adjournment, please indicate by saying aye.
Aye. Aye.
I'm not even going to ask for opposition or abstentions because you're not going to win. I'm sorry. That's just the way it is. So please, everybody, be safe. Have a very, very good day. And we'll see you on October 2nd.